Hey, this is Dr. Myers, Dr. Derm. Rosacea. Pretty complex. People get it more in their 40s and 50s rather than in their 20s and 30s. Not saying you can't get it when you're 39, but it's just usually a little later in time that you get this. A lot of people of European descent get this more commonly, and there's all different levels. You can have milder and you can have super severe. Some of the mainstay things that you see is increased redness and reactivity on the nose and the medial cheeks, and you can even get it extending on the forehead and the chin. With the redness, I'd say at least over half of patients, probably more than that, have some type of papulopustules. Pustules have pus in them, while the papules don't have pus in them, but they're inflamed follicles that have spread to neighboring follicles. Those who get this can also, in rare cases, have rosacea in the eyes. Ocular rosacea. It's more like a gritty or feel. It's almost like you have particles or sand in the eye. And you have to treat this with an oral doxy, by the way. Another thing I see is patients that just get a little bit of redness. They develop a little bit of redness, slight, on their cheeks and nose over time. And I don't move everyone over into rosacea. And sometimes I'm like taking away rosacea diagnoses and saying, you're so mild, this could just be a ruddy complexion, or erythema, which is redness, or you flush. What else do I love for these patients? So my mainstay of treatment is topical ivermectin. The trade name's called Soolantra. You can get it compounded. It's about 1%, but that's probably the best topical one treatment I use. The second thing is probably an oral antibiotic. Now you can use a submicrobial dose so it doesn't affect your gut bacteria, because you mostly need the anti-inflammatory portions of these antibiotics, and then you don't get resistance, long-term and in big populations. Small dose antibiotics, topical ivermectin, and then lastly, a couple of anti-inflammatory topicals that we use also, such as metronidazole, also called Metrogel or Metro Cream, is an anti-inflammatory. It doesn't really help redness, so you should only be using that if you are getting the pimples or papules, if you're getting the bump. Phenacea or azelaic acid is another good one. It's a little milder, it's safe, but it also decreases inflammation. Again, more for bumps rather than redness. There is a couple of treatments that just treat redness, such as Rofade, which is oxymetazoline, and it's almost similar to Visine. It is a vasoconstrictor. It's temporary, but it's great for redness for a short duration, say 5 to 6 hours around that. And there's another similar medicine to that. Long term, you can get phymatous or thickening of the skin, and you can get rhinophyma and naphiphyma if it's of the chin. You basically, this constant inflammation and healing by the body, you just get this thickening of the skin. So in those type of patients, of course, doing treatment and catching it before it becomes to that point is important. Another thing is if you can avoid flares. So say your flare is spicy foods or alcoholic beverages or heat or cold or whatever. If you can avoid those, you won't get as much permanent, set-in redness. So that's another thing we advise our rosacea patients. Hey, that's a little sneak peek into rosacea. Hope that helps. Thanks for commenting. Thanks for watching. You're the best.